If you've ever had a sore throat so irritating that even swallowing feels like an impossible mission, you've probably reached for menthol lozenges. Whether it's Hall's, Vicks, or a generic pharmacy brand, these little throat drops have become a go-to remedy for coughs, throat irritation, or that annoying dry, scratchy feeling. But how do they actually work? Many people think they cure a cold, but they don't eliminate the infection. What they do is pretty interesting. Menthol activates the cold receptors in your mouth and throat, creating a cooling sensation that can temporarily reduce pain, itching, and irritation. It's almost like it's telling your nerves, relax, everything's under control. As you breathe, some menthol vapors also travel into your nasal passages, creating a fresh, cooling sensation that can make your airways feel more open. It won't magically clear your nose, but it can make breathing more comfortable. These lozenges also stimulate saliva production, helping keep your throat lubricated and reducing the urge to cough, especially if you're dealing with a dry, irritating cough. For the best results, let the lozenge dissolve slowly in your mouth. Don't chew it like candy or swallow it whole. This gives the menthol enough time to coat your throat and provide gradual relief. There are also a few precautions to keep in mind. These lozenges shouldn't be given to young children because of the choking risk. If you have diabetes, look for sugar-free versions. And if your sore throat is severe, comes with a high fever, causes difficulty swallowing, or your cough lasts more than a week, it's time to see a doctor. Lozenges help relieve symptoms, but they don't replace proper medical evaluation. Finally, just because they're small doesn't mean you should use them without limits. Taking too many can irritate your mouth or cause mild stomach discomfort. As with most things, moderation is key.